Hey guys, Dr. Ryan Rebowe here with the Park Clinic for Cosmetic and Reconstructive Surgery. And I wanted to talk a little bit today about a very common procedure we see people for, which is the eyelid lift or blepharoplasty. So this is a common procedure that we see and do and things that we get asked about a lot. And so I just wanted to go over some common questions and concerns and what we typically will do to address it surgically. So the common thing that people come in for is not necessarily just saying, well, I really want a lid lift. They come in and say, I'm tired of looking tired. I'm tired of people asking me if I got enough sleep and that sort of things. So what they're commonly talking about is the fact that your eyebrows will droop very slightly and your upper lids have excess skin, making you appear tired. Also, on your lower lids, you may have a little bit of puffiness there, or what people would commonly refer to bags under the eyes. And then this little part of the lid, sort of by the nose, which is what we call the tear trough, can be accentuated. Now, there are multiple reasons for all of this. We'll start kind of from top to bottom, but from the very top, most people will be able to tell that your eyebrows do tend to sag a little bit as we get older. This is actually a genetic thing. There's some anatomy there that is accentuated in a lot of individuals that allows your brow to droop down a little bit, which will cause a heavy look to the brow, and also what we call lateral hooding, which contributes to the excess eyelid skin. And so even though most people come in for just an eyelid lift, the majority of people will also need a brow lift. Now we can do this lots of different ways. One of my favorite ways to do it is with an endoscope, or what we call an endoscopic brow lift, where instead of having the large incision all across your head, we can do it with several smaller incisions and actually lift the brow from the inside. And this really prevents that overdone look that a lot of people are concerned about when you talk about a brow lift. Now, moving down to the upper lids, most people are concerned with upper lid skin, or having too much upper lid skin, rather. And again, I think for most people, the dropping of the brow can contribute to the skin, but of course, there's an inherent nature of the upper lid to accumulate skin. So what we'll do is we will do a skin excision, and we'll remove a little bit of fat from the upper lid that will also help your upper lids from looking too puffy. A very small percentage of people who need the upper lid lift will also need what we call a ptosis repair, where your eyelid droops a little bit too much over your eye. And we can also perform this during the same procedure. Now, an important thing to note about the brow lift and upper lid lift is that it's often covered by insurance if it is affecting your visual fields, meaning you have to go to an optometrist or an ophthalmologist to get a visual field check to see if it's preventing you from seeing some of the things on the outside of your vision. And if it is, and if it's obstructing your vision enough, then your insurance will actually pay for that procedure. Now, what insurance doesn't typically cover is any procedure on the lower lids, or what we would call lower lid blepharoplasty or lower lid lift. This anatomy comes from the actual, your mid-face actually drooping and sagging, causing your lower lids to be a little bit puffy and accentuating, again, that tear trough that we talked about. So what we do typically during this procedure, again, most people who need a lower lid lift will need some sort of skin excision. So we will make a small incision on the underside of the eye, just below the lashes, and we'll excise some skin. We'll also either remove or reposition some of the fat in the area to blend what we call lid cheek junction, and give you a more natural looking, natural appearing lower eyelid that, again, doesn't look quite as puffy, doesn't have as much skin. So we do feel like these procedures are very highly satisfying to most patients. Most patients are very pleased with the results. And most commonly, we are doing 4 lids at the same time. So again, it's uncommon to need an upper lid lift without a lower lid lift, although a lot of people who are just getting the insurance procedure will just do the upper lid lift and get excellent results. So if this is something that you're interested in, just contact either Dr. Park or myself, and we'd be happy to either talk to you about it either over email, or you can come in for a consultation.